Today, we're going to talk about adrenal fatigue. Think of adrenal fatigue as the waiting room for type 2 diabetes, hypothyroidism, and heart attack. As a disease classification, it hangs out there with other preconditions like prediabetes and prehypertension, and is a strong indicator of which direction your health is headed, namely down. The exhaustion of the body's ability to react to the signals from the brain and pituitary gland inevitably contributes to disease states like type 2 diabetes, hypertension, and hypothyroidism. Because adrenal fatigue affects a cluster of body symptoms, treatment is incomplete if it just targets individual dysfunctional pathways. Adrenal fatigue patients can present with any of the following symptoms: constant tiredness, need for extra sleep, inability to cope with stress, reduced libido, low back pain in the area of the kidneys, sighing, yawning, recurrent infections, irritability, moodiness, and cravings for sweet foods. It's important to differentiate adrenal fatigue from chronic fatigue syndrome, which is typically a post-viral fatigue syndrome characterized by disabling fatigue occurring chronically after minimal exertion and with duration of at least 6 months. Saliva testing for cortisol levels and measurement of thyroid hormones in the blood are essential to establish the baseline diagnosis and to confirm the dysregulation within the endocrine system. But thorough treatment of a complex and sometimes tricky condition like adrenal fatigue involves more than simply boosting cortisol or other hormones. You need to be treated with substances that simultaneously restore balance in multiple physiologic systems in a multifaceted, complex way. Why herbs? When a human body isn't functioning optimally, it's seldom the fault of a single ginseng dysfunctional pathway. More often, there are dysfunctional cascades occurring that crisscross multiple pathways. Hormones exert their effects in large part as a result of their interaction with each other. For example, elevated estrogen will increase sex hormone binding globulin, SHBG, which will in turn decrease thyroid hormone receptor activity. Drugs typically regulate single isolated pathways, and they can effectively manage one component or symptom, but may do little to improve the underlying multi-organ dysfunction. Herbs, however, contain multiple physiologically active compounds and bioactive metabolites that affect multiple pathways and physiological systems. Humans have a long history of consuming plants to support health. Common herbs like rhodiola, Korean ginseng, and ashwagandha are excellent examples of plants that help the body maintain homeostasis, in part by managing cortisol. Traditional healers understood that nature's provided plants with complex biochemical systems for regulating their own physiology and increasing their odds of survival. The team here at MicroCell feel we have created the most powerful adrenal support supplement ever created, combined with the best microsome delivery system for micronutrient absorption into the body. Order today and join the 50,000 plus customers taking control of their adrenal support needs.